What is stigma? Stigma is a set of negative and unfair beliefs that a society or group of people have about something. When our patients fear or anticipate stigma, they are less likely to talk to us about their substance use or mental health, and we miss opportunities to provide necessary behavioral and medical care. So, it's up to us to acknowledge and address stigma in ourselves and our systems. Unfortunately, stigma surrounding mental health and substance use is common among the public, professionals, and across all community sectors, including healthcare. We may not be aware of them, but we all have biases and stigma. This doesn't make us bad people, but it's important to recognize our biases and be mindful of their impact. A lot of people think that addiction is a personal choice, that people with addiction just don't have enough willpower to quit. This is scientifically incorrect. Addiction is a chronic health disease, just like diabetes or heart disease, not a moral failing or personal choice. As providers, we can build trust from the very start using empathy, active listening, being transparent and trustworthy, treating patients with respect, empowering them to make choices about their own care, and not judging their choices and decisions. We can use person-first language to minimize blame and shame, and remember that there is no right or wrong way to recover. In our practice, we can conduct universal screenings for mental health and substance use. We can familiarize ourselves with medication for addiction treatment and medication for opioid use disorder, which are the standard of treatment for pregnant people with substance use. And we can promote life-saving harm reduction practices and resources available in our communities. Even when we do our best to be mindful of stigma, we may have patients who are reluctant to be open with us because of negative experiences they've had with past providers. These stigmatizing and often traumatizing experiences can have a lasting impact on the people we serve. Validate these experiences and don't be discouraged. Changing the narrative takes time. Continue to lead with empathy, empower your patients, and address stigma not only within yourself, but within our broader systems. Real change comes when we work together. For more information or to find support in your area, visit the DEMAS Women's and Children's Services page. And for additional resources on addressing stigma, visit the Substance Exposed Pregnancy Initiative of Connecticut.